This week on Healthy Living, tackling sickle cell anemia, a genetic disease that experts say is more common among people of African descent. A sickle cell patient shares his story of living with the condition in Rwanda. Health authorities in Uganda scramble to contain an outbreak of Ebola. Plus, a new laboratory in Uganda keeps track of zoonotic diseases in the country and beyond. We'll have these stories and more in this edition of Healthy Living. Hello, thank you for joining us for another edition of Healthy Living. I'm Linor Moudou. It is a disease that can rob children of their childhood. Sickle cell disease or sickle cell anemia is an inherited blood disease that causes a healthy rounded red blood cell to become rigid, sticky, and to fold up like a sickle or crescent shape. These cells reduce blood flow throughout the body, creating pain, damage to vital organs, and life-threatening health conditions. Sickle cell anemia is one of the most common genetic disorders in the world. The condition is more common in certain ethnic groups, including people of African descent, as well as of Middle Eastern, Asian, Indian, and Mediterranean descent. Either both parents must be carrier or one parent has to have the disease. If both parents have trait genes, they have 25% chance to have a child with sickle cell disease. About 300,000 children are born with sickle cell disease every year, according to the World Health Organization. Many of them die before their 5th birthday. But observers say there is hope with early intervention and access to proper care.
Sickle cell disease causes the body to produce sickle-shaped red blood cells, making it difficult for patients to transport oxygen from the lungs. Dr. Prebu Barango is the medical officer at the World Health Organization's Regional Office for Africa.
Sickle cell is the most prevalent genetic disease in the African region. Globally, we have about 120 million people with sickle cell, and 60% of these are in the African region.
Uganda has been dealing with a high burden of sickle cell disease for over 70 years and was one of the first countries to report it as such in 1949, according to research published in the Lancet Global Health. Daniel Odor is the executive director of the Uganda Sickle Cell Rescue Foundation. He says the numbers are still too high.
In Uganda, about 20,000 to 25,000 children are born with sickle cell annually in the country. And out of that, between 50 to 80% do not cross to their 5th birthday.
Medical experts say early diagnosis is key to help reduce the long-term impacts of sickle cell disease on patients. However,
in the African region, most countries with a high burden of sickle cell disease don't have newborn screening in place that is comprehensive enough.
Odor says testing is an essential aspect of the organization's strategy to raise awareness.
We have been in position to scale up testing in the country. Much as this is being done, there are also still other challenges. For example, there is lack of testing kits.
There are treatment options once a child is diagnosed with sickle cell disease, but experts note that getting the right care can be costly and isn't always accessible in some parts of sub-Saharan Africa, especially in rural areas. Dr. Barango says there are some ways to remedy this.
To decentralize care to the lowest level of care available, which is the PHC, so that people that live in the rural and peri-urban areas can have access to this early diagnosis. The other is on making sure that hydroxyurea is a medicine that has been shown to reduce frequency of sickle cell crisis, is made more accessible.
Research shows that people with sickle cell anemia are more prone to infections. One of the major problems for a child with sickle cell is the occurrence of strokes because of the blockage of blood flow to the brain, which is most crucial at age 5. Medical experts say the dangerous incidents can be prevented by blood transfusion.
What are your thoughts about sickle cell anemia? Do you know anyone with the disease? How well are you informed about sickle cell disease? Here are some reactions from Lomé, Togo.
I found out I had sickle cell disease when I was 19. It's true that in my childhood I had small pains that were sometimes treated at home or with injections at times. But I really became aware of the disease when I was 19, and it was due to a seizure. I had a crisis in a bank, and that's how I knew I had something called sickle cell disease, which is a hereditary disease. I have several forms of seizures. Sometimes I have bone pain, sometimes respiratory pain, sometimes I have high fever, which aggravates my condition.
I started to manifest the disease after 2 years old. At the time, I was unaware what sickle cell disease was. It was around the age of 8 or 9 years old that my parents began to explain to me what sickle cell disease was, and that I carried the SS genes. The disease is often manifested by chronic pain in the joints. It can be the knees, the hip, but it's always at the level of the bones and the joints.
I have an older sister who suffers from sickle cell disease. Often when she has her episodes, I don't know what to do to soothe her because she's in pain. We go to the hospital, but we also need to have the financial means because in the hospital we have to pay first before being treated. To accompany her, I often make sure that she wraps herself well before going out. When it's cold, she can also have issues when she's too hungry, so you have to make sure she eats on time.
Dr. Mustafa Abubakar Jamda is professor of community medicine and public health at the University of Abuja in Nigeria. He shares some insight on sickle cell anemia.
The treatment options are usually conservative. Usually is to prevent those conditions that could lead the individuals to having what is called crisis of sickle cell disease. The children should be prevented from having any infection, particularly malaria, because malaria also affects blood. The parasites is deposited on the red blood cells, and they should not be exposed to excessive temperatures. And their level of blood should also be tested regularly, so that when the blood level is low, then they could be detected, and if it needs transfusion, they could be transferred. Otherwise, they could be given some supplements that could aid them in increased production of their red blood cells, because they have increased destruction as a result of the sickle shape of the blood cell. There is no cure per se for sickle cell. However, there are very advanced surgeries that could be done. And one of these surgeries that could be done is bone marrow transplantation, where the complete bone marrow is replaced. If the bone marrow is replaced, we will not say it's cured per se. The gene will remain the same, and that person could be able to still transmit the disease to their offspring. However, the advantage is the fact that the person won't be manifesting with all these other symptoms. Now, the Federal Ministry of Health in Nigeria has come up with a lot of strategies, and this strategy is they are bringing down, testing for sickle cell disease down to primary healthcare level, so which makes it available to almost everybody in the community. There is no political ward that don't have more than one primary healthcare center. But people need to be aware that this test is available in this facility, and they could assess it before they go and assess it.
28-year-old Ame Mukundwa was born in DRC. His family moved to Rwanda when he was a toddler. In his childhood, Ame was always sickly but had no clue what disease he was suffering from. Later on, he went to the hospital where blood tests were done, and he was diagnosed with sickle cell anemia. He is one of 7 siblings, but only he and one of his siblings suffer from sickle cell anemia. He shares his story.
So you live with it, you go with it, and you die with it. But if you take medicines, you can live even 70 years old with it without any problem. But it's that medicines of sickle cell anemia, they are very, very expensive. And some of them, we don't find them in Africa. When I'm in crisis of sickle cell anemia, you can't control the pain. My back, my legs, and my arms. I can't move from the bed when it's cold. That's the worst part. You can't move. You can't go outside. Not even 60 seconds, you will start feel the pain. There is a big difference between the day before the pandemic of COVID-19 to today. Before, we used to get medicines on a cheap price. And we used to get at any pharmacy. Nowadays, they are very, very hard to get them here. And so when I'm in crisis, I used injections because those medicines they prescribe us to drink, we can't find them. All I have to tell you guys is always be strong and always take your medicines on time and daily, every day. Don't miss even one day, because if you miss 1 or 2 days with your medicine, the day the crisis will come to you, it will be painful, very painful. So be strong wherever you are. God is with us and it will be okay.
Health authorities in Uganda are ramping up efforts to contain an outbreak of Ebola in the country after a case of the relatively rare Sudan strain was detected in the country's central Mubende district. A 24-year-old man showed symptoms and later died. The virus has now spread to neighboring Kiegegwa and Cassandra districts, bringing the cumulative number of confirmed and suspected deaths to at least 23, and no less than 36 cumulative cases, including confirmed and probable cases, according to health authorities in the country. Monkeypox and COVID-19 have raised awareness around the world of zoonotic diseases that are passed between animals and human beings. The Ugandan government has built a laboratory that tracks zoonotic diseases in national parks where many communities live close to a wide variety of wildlife.
Inside the park at Mwea is this newly commissioned Uganda Wildlife Authority Diagnostics and Research Laboratory. The facility monitors incidents and acts as an early warning system for the transference of zoonotic infections.
If we were not able to get support from the UVRI, the Uganda Virus Research Institute in Entebbe, we would have to ship these samples abroad to be able to determine what disease we have. So working with our partners from the US called DITRA, they offered to help us construct a biosafety level 2 laboratory that is constructed in Mwea. That laboratory is now operational.
The outbreaks of COVID-19 and monkeypox have raised concern among scientists about the recurrence of zoonotic diseases that are passed between animals and humans. The U.S. Centers for Disease Control says more than half of all human infections, such as malaria, Ebola, and SARS, are zoonotic in origin.
We can do diagnosis. 2, we can do forensics. We are developing a pipeline for forensics, especially for wildlife, and then we do research.
A tourist died due to Marburg in Python Cave. So we are doing a study to follow up on those bats to see how far do they move from the cave to the villages.
Experts say as growing populations spill over into previously undisturbed areas of wildlife, the risk of transmission of infections between animals and humans increases.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linoch Moudou. Until next time, stay well and strive to make every day a healthy day.